Nearly 2,000 experts working in the field of mother and child healthcare gathered for the first biennial International Maternal Newborn Health Conference in the city of Cape Town, South Africa this week. The event, which was hosted by the South African government and non-governmental organizations, is aimed at accelerating solutions to improve maternal and newborn survival, as well as prevent stillbirths. Renee Delcarme has more.
According to a new UN report launched at the conference, there hasn't been much global progress in reducing the deaths of pregnant women, mothers and babies since 2015 due to decreasing investments in maternal and newborn healthcare. The report shows that over 4.5 million women and newborn babies die every year because they do not receive proper healthcare.
Globally, a pregnant woman dies every 2 minutes. And for every woman who dies, up to 4 or 5 newborn babies die of preventable causes.
Delegates from 96 countries issued a rallying cry for renewed action to meet the 2030 Sustainable Development Goals targets for maternal and newborn health and reduction in stillbirths.
I think one take-home message from this movement is that we're getting the scientists, we're generating also a political drive to support countries in making sure that the agenda of preventing avoidable maternal deaths is high in the agenda in terms of economic planning, in terms of budgeting, and in terms of allocation of resources.
UNICEF is saying that we do have a maternal and newborn crisis on our hand at the moment, but if we do things differently, if we break down some of the silos, if we integrate on the platforms of service delivery, if the government is accountable and provides resources into the health sector, there is hope. We can still make it to the 2030.
But based on current trends, experts say more than 60 countries are not set to meet these crucial targets.
I've learned a lot of information from the countries who have done well in reducing maternal mortality, and that's a great example in which I can take back home to Somalia, where still we have a lot of maternal deaths and newborn due to so many challenges.
It's a really amazing opportunity to learn about this space in global health because I feel that neonatal care, there's many sick and small newborns that need help, and this is a great way to learn from others and also have other people see our innovations.
We need to move from just the excitement of being here in the conference, but ensure that the voice of the newborns, the voice of the mothers, and the voice of the children are heard in every parliament, in every discussion, in every meeting, but not just at the highest level. This voice for the mother and the newborns, this movement has to be heard even at the grassroots.
And they say the affected countries, healthcare workers and communities have to change the pace they are going at currently. Renee Delcarme, CGTN, Cape Town, South Africa.